From celebrities to political leaders in Washington, D.C., pretty much everyone with an influence has been telling us that we need to wear masks while in public. But where's the evidence that supports that? We've all, at some point over the last 3 months, pretty much everybody has worn a cloth mask, myself included, and we've all heard one version or another of the same line that if you don't wear a mask in public, you don't care about other people and their safety. That statement is not only problematic and unethical, but it's a belief held by millions of people across the country. And so we should take steps to make sure we're informed about mask use and the effectiveness of masks because of that. I'm definitely not a licensed doctor. I don't have any sort of degree that would qualify me to talk about masks, but I have, over the course of the past few months, made sure that I have been informed about the actual facts of the matter, and I believe I have compiled enough factual data that back up my claims so that I can be credible today. So I'm going to be talking about the lack of evidence supporting the use of masks, cloth masks specifically, the health risks associated with wearing masks, and then what you can do instead of wearing masks in public. So first of all, let's talk about the lack of evidence supporting the use of masks. N95 masks are efficient and they do work for filtering out viruses and small particles, but cloth ones are not. According to the Center for Infectious Disease Research and Policy Commentary on Coronavirus, N95 of course has a 95% efficiency, that's what it's named for. Surgical masks have a 55% efficiency and cloth masks have a 2% efficiency, which is not going to do anything for you. They're essentially a placebo. It lures you into a false sense of security, so when you're wearing a mask, you think you're protected, but that 2% efficiency is not going to keep you safe from a virus. And so because of that false sense of security, you're going to be less likely to adhere to other safety measures and social distancing because you feel safe with your mask. And then also, since the beginning of the pandemic, we've been told that the main reason for wearing a mask is because you could spread the disease to others without even knowing you have it. But that has been proven to be not entirely true. Maria Van Kerkhove, the technical lead at the World Health Organization, came out and said that spread of coronavirus among asymptomatic people is rare. So that has, the main reason for wearing masks has proved to be false. So now that we've discussed the lack of evidence supporting the use of masks and their ineffectiveness, let's talk about the health risks associated with wearing masks. So in the May 18th, 2020 article published in the Science Times titled, "Are Masks Effective Against COVID-19? The Pros and Cons?" They basically listed 3 main health risks associated with the use of masks. First of all, hypoxia, which is essentially just a lack of oxygen entering your body, and so the mask filters out and restricts the amount of oxygen you can breathe in. And then along with that, the second reason is it forces you to recirculate carbon dioxide into your body. So in tandem, those two can be very negative for your well-being. And then thirdly, wearing a mask, a cloth mask, essentially just creates a virus breeding ground. It's a nice, warm, moist place for that virus to populate, and that 2% efficiency is not going to keep the virus out. So when you inevitably, if you're exposed to the virus, you're going to breathe it in, and that mask is going to keep it there right on your face, where you're constantly breathing it in. So you're actually more likely, if you're wearing a cloth mask and you're exposed to the virus, you're more likely to come down with the virus. The World Health Organization doesn't even recommend that healthy people wear masks. Back in February 2020, February 15th, they made a YouTube video basically saying that healthy people should not wear masks. You should only wear them if you are immunocompromised or if you are feeling symptoms of coronavirus. So now that we've talked about the health risks associated with wearing masks, let's talk about what you can do instead of wearing a mask to help keep yourself and others safe, even though some people might not think that that's your priority when you're not wearing a mask. So it's pretty simple once you have the facts. Really just be self-aware, know your symptoms. If you're feeling sick, don't go out in public, obviously. But if you absolutely have to, I would recommend I would recommend to wear an N95 mask very sparingly so that you limit the amount of negative health effects from breathing in carbon dioxide and limiting your oxygen. But if you really don't have to go out in public and you're feeling symptoms, or if you're immunocompromised, don't do so. And then, of course, there's also all the other safety measures that we've been told to take over the past few months that you've all heard 1,000 times. I really don't feel like I need to repeat those. It's just simple things that you can do, common sense measures, but wearing a mask is not one of them. So because of the reasons I've listed, there's really no reason for healthy people to wear cloth masks. At-risk people are a different story. If you're immunocompromised, like I said, or if you're feeling symptoms, wear an N95 mask sparingly, just to keep yourself safe. And so we've talked about the non-effectiveness of cloth masks, the health risks associated with wearing cloth masks, and then what you can do instead of wearing a mask to keep yourself and others safe. So I would encourage you, if you have developed a habit of wearing a mask in public, to discontinue use of that mask and to arm yourself with the facts so that you can defend your position when you're inevitably questioned for why you're not wearing a mask in public. Cloth masks in the pandemic age are a perfect example of how simple disinformation influences the entire world and how it operates, and how little value is held in actual facts among the popular media. Thank you.